Agnogenic myeloid metaplasia, also known as primary myelofibrosis, is a rare blood cancer. It affects the bone marrow, where blood cells are produced. The disease leads to scarring in the bone marrow. This scarring disrupts normal blood cell production. People with this condition often have anemia. They may also experience fatigue, weakness, and an enlarged spleen. Because it is rare, many people have never heard of it. Understanding this disease is important for early diagnosis and treatment. The disease can develop slowly. Sometimes it takes years to show noticeable symptoms. Early stages might be missed because they mimic other illnesses. Therefore, awareness and knowledge of the disease are crucial. Agnogenic myeloid metaplasia has two main types. The first type is primary myelofibrosis, PMF. PMF is not caused by any other condition. It occurs on its own, affecting the bone marrow directly. The second type is secondary myelofibrosis. This type develops as a result of other blood disorders. In primary myelofibrosis, the cause is often unknown. It is called primary because it is the main condition. In secondary myelofibrosis, the disease stems from pre-existing conditions. These can include polycythemia vera or essential thrombocythemia. Both types lead to similar symptoms. However, they have different origins. Understanding these differences is key for treatment. It's essential to identify which type a patient has for effective management. The exact cause of primary myelofibrosis is not clear. Researchers believe genetic mutations play a role. Mutations in certain genes like JAK2, CALR, and MPL are often found. These mutations can cause the bone marrow to produce abnormal cells. Environmental factors might contribute as well. Exposure to certain chemicals and radiation are possible causes. However, these are not well understood. More research is needed to establish clear links. Secondary myelofibrosis has clearer causes. It usually results from other blood disorders. These disorders cause the bone marrow to become scarred over time. Understanding these causes can help in managing the disease better. Section 4. Risk factors for agnogenic myeloid metaplasia. Several risk factors increase the likelihood of developing this disease. Age is a significant factor. Most cases are diagnosed in people over 50. Genetic mutations are another risk factor. Specific mutations in the JAK2, CALR, and MPL genes are common. Family history also plays a role. Having relatives with blood disorders can increase risk. Environmental exposure to chemicals or radiation may contribute. However, these risk factors are less common. Lifestyle factors are less influential. Unlike other cancers, smoking or diet does not significantly affect risk. Understanding these risk factors can aid in early detection and prevention. Section 5. Diagnosis of agnogenic myeloid metaplasia. Diagnosing agnogenic myeloid metaplasia involves several steps. A complete blood count, or CBC, is usually the first test. It checks for low red blood cells, white blood cells, and platelets. Abnormal results can indicate a problem. A bone marrow biopsy is often needed. This involves taking a small sample of bone marrow. The sample is examined under a microscope to look for scarring and abnormal cells. Genetic tests may also be performed to identify specific mutations. Imaging tests like ultrasounds or MRIs can help. They check for an enlarged spleen or liver. Together, these tests provide a comprehensive diagnosis. Early diagnosis improves the chances of effective treatment. Section 6. Prevention and precautions for agnogenic myeloid metaplasia. Preventing agnogenic myeloid metaplasia is challenging. Because the exact cause is not known, specific prevention methods are limited. However, regular checkups can help in early detection. People with known risk factors should be particularly vigilant. Avoiding exposure to harmful chemicals and radiation can reduce risk. This is especially important for people working in high-risk environments. Wearing protective gear and following safety protocols is crucial. Maintaining overall health is beneficial. A healthy lifestyle supports the immune system. Regular exercise and a balanced diet can contribute to overall well-being. While these steps may not prevent the disease, they improve general health and resilience. Section 7. Conclusion. Agnogenic myeloid metaplasia is a rare but serious blood cancer. It affects the bone marrow, leading to scarring and disrupted blood cell production. The disease has two types, primary and secondary. Causes include genetic mutations and environmental factors. Risk factors include age, genetic mutations, and family history. Diagnosis involves blood tests, bone marrow biopsies, and imaging. While prevention is challenging, regular checkups and avoiding harmful exposures can help. Understanding this disease is crucial for early detection and effective treatment. In conclusion, awareness and knowledge are key. Staying informed about risk factors and symptoms can lead to early diagnosis. Early treatment improves outcomes and quality of life.